Hello, good morning, everybody. Today we are discussing with another topic: foreign bodies in the ear. So, I think almost people are familiar with this condition because it can commonly seen in childrens and even in adults also. So, today we are discussing how we can manage or how we can remove the foreign bodies from the ear. Let me introduce the topic. Foreign body in ear conditions where something is present in the ear that is not normally there. So how we can call the thing as foreign body if it is normally present in a particular organ, that we can call it as foreign body. Something is coming from outside that we can express it as foreign body. Common in children, especially toddlers, although they can be found in adults. This condition mainly seen in children's, okay, especially in toddlers, because in that age they are start to play with a lot of toys, and they become more they become more attractive with some of the small articles, and there's a chance of putting inside the nose, ear, and even in the mouth. And in by mistake this condition can occur in, or foreign body can enter in adults also, while you are cleaning the ear. So that time there's a chance of going inside some buds or cotton. So that is by mistakenly it is happening. So we will discuss how we can manage the condition. Next, we will see where it's stuck. Means once it is entered, it will not go to inner part of the ear. So we will see where it will stuck. Most foreign bodies will lodge either lateral to the isthmus or impacted to the side. So almost all foreign bodies are stuck inside the external ear. Okay, it won't go to inner. Located in the deep meatus, they may reside in the anterior recess. So mainly on the side of the meatus, deep meatus, it is located. So there we can identify the foreign bodies. So here I am showing a anatomical structure of the ear. So there the structures will be the outer ear canal, okay, then eardrum where it is, then temporal bone, ingus. So most of the cases the foreign body will be present in the external ear or in the ear canal. Let us see what are the types of foreign bodies which can enter inside the ear. It is divided into two types: in organic and inorganic. Organic means that are which can live, or which can which is live, okay. So it including sponge, eraser, paper, wood, cotton buds, then beans, nuts, worms, maggots, okay. So in organic also they have mentioned that sponge, eraser, paper, wood, cotton buds. So in some of the things will comes under organic. That's why they have mentioned. Organic also non-living and living is there. Both are there. And living it including beans. Okay, beans means that beach. Okay, then nuts, some kind of nuts. Nuts also, for example, cashew nut, peanut. Then worms, some kind of worms. Then maggots. Maggot is also a kind of fly, okay, or insect that we can call it as maggots. Then inorganic bead. Bead means you all are familiar with beads, because in ornaments and all you can see in your bangles or in your necklace some kind of stone or beads are there. Then metals, stone, plastic toys, button battery. Button battery is the cell which we are using in the especially in watch or in some toys also we are using. So it can easily enter into the ear. The next is we can see the some of the pictures: nuts, beans, insect, worms. Then in non-living, sponge, wood, eraser, cotton buds, etc. Or inorganic, metal, beads, battery, stones. So I think you got a clear information regarding this organic and inorganic. Let us see the signs and symptoms. What may be the signs and symptoms? It including ear pain or earache, otalgia. Last day we have discussed. Then ear discharge, some kind of discharge will be there. Loss of hearing in one ear. So the affected ear, the person will experience some kind of loss of hearing. Then reduced hearing. Sometimes the hearing capacity will reduce. Then fretfulness of child. So in child you can see in that fretfulness means it's a kind of anxious or irritable state. Okay, the child become more irritable because in child usually they can't able to express their problems. Then child scratching at the ear. Okay, most of the time they will start to scratch on the ear because inside something is irritating. So these are the signs and symptoms you can see. Next, what is about the investigation. So ear examination mainly we are doing that is with the help of otoscopy. Okay, so with the help of the instrument we can examine the ear. Then we have to examine the outer pinna also. We have to examine whether it is normal or not, no any edema, tenderness, redness. Okay, then next we will see the how to remove the. So once we identify with the help of otoscopy examination, then we are moving to the step that is how to remove, and it is depend mainly on the type of foreign body and its location. So depending on the foreign body, the method of removal will be varying or changing. Okay, so let us see techniques of treatment. It including we are using some kind of equipments for removal of foreign body from the ear. Otoscope with removal lens, microscopic otoscope, headlamp, Jobson horn hook, crocodile forceps, syringe, gauze, emesis basin, suction equipment and tubing, magnet for metallic foreign bodies, ear speculum, Sulner, sucker, gallipot, olive oil. So these are the certain equipments or things which we are articles we are using for removing foreign body, and it is depending on the type and location of the foreign bodies. Okay, let us see one by one. First about blunt hook, you can see in the fundamental law. It is useful for round, smooth object, but not if impacted. Okay, if it is impacted or if it is stuck inside, then you should not use it because it can lead to scratch over the area. Then crocodile forceps. A pair of crocodile forceps can easily grasp objects such as cotton wool, paper, pieces of foam, sponge, and insect. Should not be used to remove smooth round objects because smooth round objects what happen means when you are touching with the help of or we are picking with the help of forceps, you can see in that tip of the forceps one tooth like formation you can see. So when you are pressing that, if it is soft, then again it can go inside. It won't come outside. Instead of that, it will go inside. So that's why should not use it for smooth round objects. Then microsuction. Suction is satisfactory for the majority of foreign bodies, and in majority of the foreign body removal, we are using microsuction. Microsuction means with the suction we are attached. The suction we are doing with the help of microscope. Okay, removal should be performed with an microscope to avoid trauma to the canal or tympanic membrane. Because while you are doing the suction, we have to carefully do it. Otherwise, there is a chance of injury or trauma to the tympanic membrane. Then afterwards, it can lead to complete hearing loss. So this is a procedure we are doing for micro. There's the equipment is there with the it is attached with the microscope, and there is a small probe is there, that suction probe. With the help of the suction probe we are removing the foreign body. Let us see next step, ear syringe. Maybe you have heard about first year in the foundation. You may heard about this ear syringe. It's ideal for most foreign bodies except if vegetable material and organic type. So most of the foreign body you can remove with the help of ear syringing. We are using for ear irrigation. Maybe you are familiar with the procedure ear irrigation. But in case of organic or vegetable material, if you are using this ear syringe, so in ear syringing or ear irrigation, we are using normal saline or some solutions. So with the presence of the solution, there's a chance of that if it is a vegetable content like a seeds or some kind of vegetable beans and all, so there's a chance of enlarging the size of the seed or beans. Okay, because once a water percent is there, one moisture is there, then it will start grow inside. So afterwards it is very difficult to remove, and some of the organic also. Okay, so in that condition we will avoid ear irrigation. Irrigation must be avoided with vegetable material and organic type because this cause welling of the object and make removal more difficult. Welling means the size will increase. Okay, understood. Then this is a syringe we are using for irrigation. We will flush the fluid inside. So while coming back or while returning the fluid, the foreign material will come outside. Then for insects, how we can remove? Olive oil is used to drown live insects inside the external auditory. Crocodile forceps are then used to remove the insect. If insect is present, so you can see that if some of the insect is there, if you are pouring water in that or oil, that particular insect will come in the top of, or it will be floating, or it will come in the top portion of the uh, that oil. So then it is helpful to the for remove. Okay, with the help of the crocodile forceps, we can easily remove it. Okay. Then next one is how we can treat. After removing the foreign material, we should treat the person, because we are using some kind of foreign articles or some other methods. So there is a chance of spreading of infection. So we have to provide augmentin, that is an antibiotic, administration of antibiotic. Then if the person is having some kind of fever or some signs of uh, infection, then we have to provide administration of antipyretic, that is paracetamol. So here they mention syrup, that is for pediatric. Then you have to make a review if it is not solving after giving the antibiotic and antipyretic. If the problem is not resolving, still the person is having some kind of infection or irritation, then we have to inform them to review or to make an appointment with the doctor. Then let us see some tips and warning. Okay, it including while doing the removal, there are some tips are there. Repeated attempts at removal are unkind. So if again if you are trying to remove and if it is not coming outside, uh, instead of removing, or instead of removing it, it may worsen the situation. Means it can go inner to the, or inner part, instead of coming outside, it may go inner to the ear canal. So please avoid. Once you try to remove, if it is not coming, then you have to go for another method. If foreign is not visual, abandon the procedure. If you can't able to see the foreign object, then you should stop the procedure. You have to get a help from the doctor. To be careful during the procedure. So while doing the procedure, you know that the end of the external ear is attached with tympanic membrane. If it's some breakage, or if it is broken, then it can lead to hearing loss. So be careful. Then some possible complications are there. Acute complication of ear foreign body removal include canal abrasions, bleeding, infection. Canal abrasion means auditory canal. While we are inserting the articles or equipments, at time there is a chance of injury or abrasion. Then bleeding can occur and possible infection. Then perforation of the tympanic membrane. That is also kind of inflammation. Then otitis externa or otitis media. There is inflammation of external ear or inflammation of middle ear. Then foreign body granuloma. Sometimes the leftover part of the foreign body can lead to granuloma formation. Then tetanus may occur from sharp infected foreign body. So as we know, when we are doing invasive procedure, should be done in a sterile or aseptic technique. You have to follow a strict aseptic technique, otherwise there's a chance of tetanus infection. Then let us see what are the health educations we can provide. Wipe the outer ear with a dry cloth or tissue to dry the ear. So during or after the procedure, you should do this properly. Do not use cotton bud to clean the ear canal. It's cause trauma and the cerumen will become impacted. So while cleaning the ear or ear canal, you should not use any cotton buds. Okay, because it can lead to injury, or and cerumen will be, or blockage of wax can occur. Do not use pins or sharp pointer object to clean your ears, because this object may injure the ear canal or eardrum. Sometimes we may also doing this thing in case of ear itching, or suddenly if it is happening, then there is a tendency to put something inside the ear, either pencil, pen, or sometimes safety pin, or slides. Okay, so this can lead to, we will get a temporary relief, but while doing this one, because these all are some kind of inorganic things, though it can lead to infection. Tell the patient do not put anything into ear and nose, it causes trauma and infection. Tell the parents treating upper respiratory infection promptly to reduce the risk of ear. And tell them to treat upper respiratory infection properly. See doctor or come to hospital immediately if signs and symptoms of infection redness, fever, pain, otorrhea for early treatment. So after removal of the foreign body, you have to inform the parents that if in case if the child is showing some symptoms of infection like redness, fever, pain, or ear discharge, they have to immediately they have to respond to the hospital. Then choose a suitable play toys for your children to make sure the safety according to the age. Nowadays you can see that when you are choosing some kind of toys, their age also mentioned. This is for 1+ year, this is for 2+, this is for 3 year 3+. Okay, should not give to the small children like that. So appropriate toy material we have to choose. Seek the doctor if you notice foreign body in situ for early treatment. If you found some foreign body, if you easily you can visible or you can see, then you have to do early treatment. Continue follow up to clinic regularly as ordered to review the progress of treatment. Okay, you have to make follow up properly. Continue to take medications ordered, especially antibiotic, to avoid resistance to antibiotic. So you have to take the antibiotic proper time to in order to prevent the complication of infection. So this all about the topic. So today we discuss about foreign body removal. What are the foreign bodies? What are the types of foreign bodies? Then we have seen what are the signs and symptoms, or then how to identify or diagnosis. Then we have seen how to remove the foreign body. We have seen various equipments and methods. So then we see what are the treatment we are providing for foreign body removal patients. Then we see some complications, possible complications. Afterwards, we discuss about a lot of measures to avoid foreign body insertion, or we provide a health education. So I hope all of you understood about today's topic. So please go through the slides properly. Then if you found any difficult during the class, or if you are not able to follow my class, then please feel to contact me on my personal WhatsApp number. Thank you. Have a nice day.